Now to the controversy raging over C-sections. It is the #1 most common operation performed in this country, as we said, and some very serious questions are being raised about whether doctors are performing too many C-sections. And Dr. Richard Besser joins us now with one woman's, actually, this is an incredibly tragic story.
It really is. Elizabeth, there's a debate going on right now between doctors and health officials about the number of C-sections performed in the United States. One thing we know for sure is that the procedure is safer than it's ever been before. But that doesn't mean tragedies can't happen. When 35-year-old Linda Cole found out her baby was breech, she and her doctor decided she'd give birth by C-section. This is one of the last photos ever taken of mother and son. Linda, just 11 days after the scheduled surgery, died from a blood clot. Even when C-sections are necessary, there can be risks.
It's terrible that my parents had to bury a child. It's terrible that we had to bury a sibling, and it's even more horrific that Ben will never know his mother and how much she loved him. Come here. There's Mommy.
Now, 1 out of 3 births are delivered by C-section, up from 1 out of 5 in 1996. While C-sections are appropriate for many, there are risks with major abdominal surgery.
If you look at this country compared with other industrialized countries, we have one of the highest C-section rates of any. And along with this increase is coming an increase in very severe complications and in deaths as well.
Obstetricians believe the rise in C-sections is due to obesity rates, older mothers, and multiple births.
There you go.
Linda's family believes it's all about education. If she'd known the warning signs of a blood clot, she may have been able to make it to the emergency room in time to save her life.
That was her one goal in life, to be a great wife and mother, and unfortunately that didn't happen for us.
What a very sad story for that family, a cautionary tale. But the American College of Obstetrics and Gynecologists says that C-sections are overused in this country. Are women simply electing to do these when they don't have to?
Well, you know, it's hard to say. Take a look at these numbers. In 1996, 20% of women had a C-section. By 2006, it had gone up to 32%. One of the things that strikes me, though, is that there's tremendous variability across states. And when you see that kind of variability, it tells you that there's room for improvement. There's some things that some states and within states, some hospitals are doing that others can learn from.
You mentioned a couple warning signs, being overweight, diabetes, that sort of thing. There's also a school of thought that the way we deliver babies in this country with so much intervention can lead to more C-sections. By giving a woman Pitocin to spur labor, the contractions get so intense she needs an epidural, which means she has to lie down and can't walk around, which helps a woman give labor faster. Do you agree or disagree with that?
Well, I think that that's part of the debate. You know, what are the factors that are contributing to this? How much relates to the medical practice, things like you're describing, and how much relates to patient preference and things that patients are asking for? And, you know, I think the more that we listen to bodies and let bodies do what they're designed to do, the less you're going to lead to interventions and surgery.
For a woman who may be a working mother, may need to schedule a C-section for other reasons, what risks should she think about before deciding to go that route?
Well, it is important to realize that all surgery involves risks. With this surgery, if you have a C-section, there's a likelihood you're going to be in the hospital longer.
4 or 5 days.
Exactly. You have a higher rate of infection. And anesthesia always has complications. Not always, but you're at a risk of complications. If you have a C-section, you may have placental problems that give you a problem with having a vaginal delivery in the future.
All right, Dr. Richard Besser, thanks so much for being here with us.